In the House on the 3rd of November, I pointed out to An Taoiseach that we need to use Irish data to inform Irish decisions and not to continue to rely on NEFID advice, which is based on what the EU health authorities are saying. On the 6th of November, at a meeting with you, Taoiseach, you will recall that I questioned Dr Houlihan, the Chief Medical Officer, on his presentation as to why the rate of decline of COVID-19 infection in Dublin had stalled. While I didn't get an answer, I did specifically state that we needed a further meeting to go into those figures. It didn't happen. However, the rate of infection in Dublin continued to stagnate, and we now see the same situation being replicated across our country. Taoiseach, yesterday morning, Microsoft announced that it is to create 200 software engineering jobs to support, among other things, cloud services for its global customers. The HSE is one of those customers, using its Microsoft Dynamics CRM, Customer Relationship Management Package, a system designed to help companies manage and maintain customer relationships and deliver actionable data. As we speak, we have over 500 people working in 11 contact tracing centres, inputting large volumes of data every minute onto this system. This data has the capacity to generate reports on who, where and how people are getting infected with COVID-19. Taoiseach, this is information that your government urgently needs to make the right decisions on how we exit from the current lockdown, how we allow people to live again, allow businesses to open up and, more importantly, ensure that we don't face a further lockdown. But to do that, we need to know what this virus is doing in Ireland's population, which is both geographically and culturally very different to other EU countries. Taoiseach, this week your government will make decisions on a guess, an educated guess, anecdotal evidence, partial data, but sadly not with all of the hard, cold facts. It's akin to making up a flat-pack kitchen but refusing to look at the instructions. But while a bit of putty will cover over any mistakes in making up a kitchen, if this government and its unaccountable advisers get this wrong, then our children and their children will be paying for it. So my question to you, Taoiseach, is who is actually interrogating this Microsoft Dynamics CRM to generate the data on what is actually happening with COVID-19 in Ireland, to provide the evidence for your policy decisions that you will make later this week?
Thank you, Deputy. Taoiseach. First point I would make is I think we should stand back from creating, in my view, unnecessary rows and tensions between public health advice, government decisions and the Oireachtas' views. I accept that people have different perspectives on COVID-19 and the steps we must take to keep the virus down or open up society and relax restrictions. But I don't think we should ever question the good faith of people on all sides, and particularly in the public health realm and in NEFID, whose fundamental objective is to protect people, to protect lives and to protect public health. And we shouldn't lose sight of that in the debate. Secondly, you're correct in saying data is very important. And we have taken extra work over the last while in assessing data and in doing work on the various data, essentially data analytics within my own department and in conjunction with NEFID and indeed others. And the data will inform next steps. And that's an important point to make. It's not guesswork. And some of it may not be palatable, some will be. I said at the outset of going into level 5 that we wanted to come out in and around level 3. I think the most important point we should all make, because I just note and I can see it, we're all fatigued with COVID. The bottom line is Ireland is second best in Europe now in dealing with the second wave. One would hardly realise that with the tension about the place and the attack and the criticism and the giving out and so on like that. We're actually, I repeat, we're second best performance in the European Union in terms of keeping the virus down. Will someone acknowledge that? I think it needs to be acknowledged. And the reason we're low is because of a series of restrictions and the hard work of the Irish people. And the Irish people have adhered to these restrictions, to be fair to them, at a cost, yes, I accept that, a big cost. But the Irish people are adhering, and that's working. We'd like the figures to be down lower. I'd prefer if they were lower again, and they're still coming down. You know, I think we're on 8.7 last evening, 14-day per 100,000 14-day incidents. And I think Finland is ahead of us at about 50. Other European countries are in a much more difficult space. The big challenge for us as an Oireachtas and as decision makers is there will be risks as we move into December in terms of what we do. And there will be risks moving into the Christmas period. It's how we mitigate those risks is going to be the key challenge facing us. And our job fundamentally is to represent the people of the country, all of the people of the country, in terms of protecting them and livelihoods. And there is an enormous economic cost to the restrictions, and particularly in travel, tourism, hospitality, food accommodation. That's where I sense the biggest impact has been. But remember, this level 5 has taken place in the context of the schools being reopened and staying open, which has been a tremendous boost to the parents of those children as well, many of whom have to go to work and who wouldn't be able to go to work if the schools weren't open, to the children in all the school communities. We've kept health services open alongside of the COVID stuff, which wasn't the case in the first lockdown. Construction has stayed going in terms of constructing badly needed houses and infrastructure,
time is up,
and the manufacturing and thank you.
Our job is to make decisions based on evidence. And Taoiseach, don't let them fob you off and tell you that they're using the output from the CRM, because they're not. The Health Protection Surveillance Centre is using data from a laboratory reporting system that was never designed for this pandemic. Hospital-based occupational health doctors and some public health doctors investigating outbreaks don't use the CRM, so many of the health-related outbreaks are not entered on it. Yet at this moment, we are still seeing a huge number of cases associated with hospitals and care homes, both patients and staff. From my own investigations, it is spreading in these settings and spilling over from staff into communities. I also understand that there are 12 hospitals currently with restrictions on elective procedures because of COVID outbreaks. If we were to actually use the data that we have, it would allow you as Taoiseach to tell the Irish people with authority what they need to actually do to control this particular virus.
I don't disagree with the Deputy in terms of utilisation of data to inform decision making. I think that's very, very important, and there's various sets of data that can inform, decisions in relation to that. And you are correct in saying there has been an outbreak in certain healthcare settings, which has been problematic for those specific healthcare settings in terms of dealing with the normal throughput of services and so forth. So this is there is in informing our decisions. Is an approach that is based on analysing data. And without question, I think I'm safe in saying that after level 3, the decision to restrict visits to households was a key decision that did impact on reducing numbers, even prior to level 5 coming in. So the spread within households has been significant overall in terms of the spread of the virus. I said it yesterday, and you can apply that to both households and other locations where you have gatherings associated with events, associated with alcohol. Yes, you do get a spike. Data does show that in certain areas, certain contexts, fairly unequivocally. So I think you're correct in your broader point in terms of data needing as best we can. The higher you go in restrictions, the more blunt an instrument they represent, because fundamentally public health officials want the congregation down as low as possible, and that's your best route. And so back with it, but people have been very good, I think, in adhering to this for 6 weeks. We're going to have to maintain our vigilance on this. The fact that a vaccine vaccines are on the horizon should be a reason for doubling down on best behaviour and making sure we keep the virus as low as possible until we have more widespread use of the vaccine in the population.